5 myths that I'm gonna burst for that you have for chiropractors today. That's my topic for today. But before we start, I will just hold on and give you some ideas about our upcoming camps. Well, firstly, we just finished our camp in Bangalore last week, and thank you so much for such an amazing response we had for the Bangalore camp. We saw really a good number of patients, and thank you so much, and wishing all our patients a very speedy recovery. We'll be in Bangalore again in the month of May. We'll shortly announce the date for the same. And I hope you guys can hear me. There are no issues with the soundtrack. The topic for today is 5 myths that I'm going to burst for chiropractors. I will be taking your questions also if you have any. So make sure you keep typing your questions. And yes, I will take up all your questions. But before that, talking about our camps which we have for the month of March, we are in Ahmedabad from 14th to 17th of March. So Ahmedabad people, you can take up the appointments for Ahmedabad. The number, I am just putting the number here. The number is 86673 8000 for appointment. This is the number. 14th to 17th of March will be available at Ahmedabad. And yes, we are in Mumbai on 2nd and 9th of March, as well as in Thane, since we are based in Thane. So talking about today's topic, that is myths that people hold about chiropractors. What sort of ideation, what sort of thought process do we carry? I'm sure a lot of people do not visit chiropractors, but they definitely have heard about them, or they definitely know something about them, because of which they have their own thought process, or they have their own idea or knowledge. So I just want to burst a few things. First thing is that the chiropractic adjustments are not safe. That is a complete myth, because chiropractic adjustments are much less invasive. They are not like medical treatments which requires high level of intervention. Besides that, it also is not dependent on painkillers, wherein it has a lot of side effects, because if you are taking painkillers for a long time, they definitely have a lot of side effects for the same. So that's one thing where, if you talk about the adjustment safety for chiropractors, it's like 1 in a million chance where a patient can probably get some issue, which is only connecting it with high risk of stroke. It is not even that a patient who comes to a chiropractor can get a stroke. It is only about a connectivity, that there could be a possibility, and that is 1 in 10 lakh people. When I say 1 in million, it is 1 in 10 lakh people. So that's the amount of variation we have. Giving you a simple comparison would be, if you talk about spinal surgeries, the same thing goes for 1 in 1 lakh people. Okay, you can expect spinal surgeries to do about 95 to 96%, wherein 5% chances are that 1 in 100 people can get issues with spinal surgery. So that's like a comparison. The same thing goes for chiropractic adjustments, 1 in 10 lakh people. So that's the amount of safety we talk about chiropractic adjustments. Second thing is that chiropractors are less educated than doctors. Talking about the working hours, or talking about the educational hours that the chiropractor has to spend, is equally there when you compare it to any physician or a health physician equivalent to MBBS or anything of that sort. Besides that, talking about the subjects that we go through, you learn anatomy, you learn physiology, you learn more or less all the subjects pertaining to musculoskeletal conditions with human body, pertaining to all the areas that needs to be covered for a human body. So it's nothing that they are less educated compared to any other physician or any other ND. The third myth that people normally carry is, if I get to crack my own back, there is no need for me to go to a chiropractor. Well, that's completely a sort of mistake, because what you feel is that when you go to a chiropractor, it is just meant for cracking. That may not be the case. There are a lot of positions, there are a lot of places where we don't really take up that, we don't get the sound, we don't get the cracking sound, and the cracking sound is not the exciting part, or is not the healing part in this whole adjustment. There are a lot of places where we only do the adjustment in such a way that it helps you to improve your overall health condition or get rid of that problem. So it's not that every movement that we do will give you a crack, and the cracks that you get more often with people who do self cracking, or even that people who, you know, your friends do probably maybe doing cracking for you. If you go through that, you will come to know that your experience is not the same, because the movement is very very abrupt. The movement is just about trying to create a sound, which you can also see early morning, which you could also see when you just rotate your spine, or probably when you can move your neck. You will obviously get some cracks. That doesn't mean that it is equally effective when you compare it with a chiropractic adjustment, because if you see chiropractic adjustments, if you even see my videos, there are certain placements, there are certain ways that we are doing it, there are certain palpations that we are doing it in order to understand where are the subluxations, where is it that the adjustment is required, and how we can go through that. So that's that assessment, that examination, and that finding in order to understand what exactly is going on and where this adjustment is required. That's very very important, that only a chiropractor or someone who's doing a spinal manipulation can understand. And sounds can come from anyone. I repeat, sounds can come from anyone. But what is more important is that how well it is healing for you, how well it is giving you uh, that feeling where, you know, you are getting better. So that's something which is very 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 important. So don't feel that, you know, whatever adjustments, or it's all about sound, because sound can be done even if you're at home, or it can be done for your friend, or it can be done by someone who does this more often, and that's why he becomes a chiropractor. That's not the case. All he's doing is just producing sound. So you need to understand the difference. One more myth that people have, I've already covered 3 myths. The fourth myth that people have is chiropractors treat only back and neck pain. Well, that's not the case. There are many conditions that actually chiropractor treatment helps, because conditions like frozen shoulder, you have conditions of TMJ, temporomandibular joint, wherein, you know, you have issues with the temporomandibular area. Migraine and headache plays a very important role. Chiropractic adjustments plays a very important role in migraine and headache. I have seen a lot of patients who have benefited really well with migraines and headache also. Shoulder, frozen shoulder, like I said, a lot of sports injuries, also help. And I have seen so many conditions where we have just tried and seen certain times there are issues like breathing. A lot of people feel that they are not able to breathe completely. The vital capacity is not, the capacity or the way to breathe is not complete for them. And after doing an adjustment, they feel that the breathing capacity has improved. The overall ability to breathe has improved. A lot of hip mobility issues can be taken care of with chiropractic adjustments. So it is not just back and neck that the chiropractors treat. They also treat a lot of different conditions like this, a lot of musculoskeletal conditions basically, which actually, you know, come across because of our sitting posture and all the sort of fixed positions or postures that we hold across. So that is another myth that a lot of people do carry. One more thing that I have come to know, or I have understood from what people feel about chiropractic therapy, is that it doesn't work, and there's no research to back this up. Well, this is completely wrong, and there has been enough research in US and all of the developed countries, and they have accepted willingly that chiropractic therapy works. Of course, chiropractic therapy doesn't have millions of dollars to spend on advertising or to spend on research to understand its overall process. But as of now, the people who are actually even talking that chiropractic therapy doesn't work, a lot of medical community people from medical community were talking about the fact that the idea that chiropractic therapy doesn't work. But today they also accept that yes, it definitely works. And in most of the immediate conditions, whether it is postural issues, whether it is sports injuries, ideally chiropractic therapy is the first thing that should be taken as a mode of intervention, even before going with medicines or going with painkillers and things like that. So that's the importance of chiropractic therapy. And research has already seen, we have seen about more than 8 to 9,000 patients as of now. And I think the results we have seen with patients, the sort of reviews we have seen with patients, it really feels blessed that we have been able to make a difference into their lives. And yes, obviously, I mean, this therapy works with them, and that's the reason they come to us. Sometimes I see patient who who have been advised to come for a follow up. They see me exactly after 3 months or sometimes even 6 months, because they're like 6 months. In the last 6 months we've never felt that we needed you, because it was so good, it was so well done, that there was no complaint at all. So this is something what we need to understand, that that is the effectivity of a chiropractor. When you compare this with let's say painkillers, when you compare with a normal therapy, that's where you come to know that how the effectivity, and it is not just about the effectivity, but it is also about the side effects that you have when you take painkillers or any other form of drugs. A lot of people, one more myth that people also have is that once you go to a chiropractor, you need to go there forever. So see, if you talk about an adjustment or a process, well, there are probably 2 or 3 sessions required from a chiropractic therapy point of view. Okay, and if you have to get better, you should get better in the first month with about 3 to 4 sessions only. And then if you have to do a follow up, if the chiropractor wants to see you maybe after 2 months or maybe after 3 months, that's where it works. And people who come to chiropractic adjustment, once they see their benefit, they actually willingly come for any other issues that they notice. So even before going to a general health practitioner or a specialist, they prefer coming to a chiropractor and get it adjusted instead of having medicine. And that's the reason that you see them coming on and on. But it doesn't mean that you have to see a chiropractor forever. There are a lot of places where probably just an adjustment can even do your work, and you may not have to take up medications, or you may not have to take pills. So that's how the chiropractic therapy works. And it's not that if you see a chiropractor once, you have to see him forever. You could always see him for maintenance. You could always see him where you have some minor issues, or probably once in 6 months where you want to just get adjusted and feel better. You want to improve your overall relaxation, you want to improve your overall end range of motions, and which we normally don't tend to use, and that's where the chiropractic adjustment plays a very important role. So these are some of the facts where I think the reason for long-term therapy for chiropractic comes into work. A lot of people also feel that chiropractic adjustments do not believe in drugs or surgery. I see a lot of patients, and we a lot of times we also ask them about their reports to understand the severity, and we do understand that it's not everything that chiropractic therapy will work in. There are places where if the patient has a very severe issue, if the patient has an issue which is also a question in terms of stability, surgery may be an option. There are places where surgery may be an option, and that is what we advise them. We always tell them that in this condition, I don't think it is good for me to get an adjustment for you, because I think surgery will be a better option. Because besides the adjustment, what is also required is a sort of exercise that has to play a role. There's the stretching that has to play a role, a little bit of strengthening that has to move on over a period of time. So these are the things that are required. And that's the reason we also refer a lot of times to patients and tell them that probably surgery at this point of time is a good option. Sometimes just an adjustment may not work in terms of getting your pain right in the first 24 hours, or probably in the first 2 days also, when the pain could be very severe, and that's the time where we sometimes also advise painkillers. So it's not that we are completely against drugs or surgery. It is all about how and when it is required. I mean, you cannot get every patient operated who has a back pain. In a similar manner, you cannot get every patient treated who will get a chiropractic adjustments. There are different levels, and there are different way to look at it. So I think what works is, for a specific patient, is the present condition, the clinical condition, how we can correlate and how we can do it better. One more myth that I would also like to bust here is that chiropractic adjustments are painful. That's not really a fact. Obviously, you're moving a specific joint, whether it is neck, whether it is back, whether it is hip, whether it is shoulder, all of these things. So obviously, when you're moving a joint, you're not just moving a specific joint, but you're also moving the muscles around that joint. A lot of time, the muscles may be very, very tight. So when you move the musculoskeletal system, there could be a little bit of pull, there could be a little bit of soreness, which will stay only for about 24 to 48 hours, okay, not beyond that. So it's saying that chiropractic adjustments are painful may not be the case. There are a lot of patients who actually, message me after 2 days that they're feeling wonderful. Yes, they had a little bit of soreness in the first day, but now things are really, really good. So that also again is a myth that chiropractic adjustments are painful. Okay, so that was my topic about the myths. And yes, I can take any questions now. If you have any questions, please type it so that Milsha has a question. I have problem with hair, too much of hair loss. What type of exercise should I do? Can you suggest? I don't think I have something in this area. This is really not my forte, so I will not be able to talk much about hair loss. So sorry, Mil, about that. Alright guys, so once again, I don't see many questions right here. Mill had asked a question and I've already replied. Kunal Sapkal has asked me Thane numbers. It is the same number applicable for all our locations. This is the single number, or this is the only number where you can take appointments. So even if you want to take appointment for Thane number, you can connect on this number also for Thane center. James Homespa, namaskar. How are you? Thank you. I'm good. Kritika Kapoor, hi, how are you? Single chocolate, hi everyone. Thank you so much for joining in. And talking about our future camps, we are in Ahmedabad from 14th to 17th of March. 2nd and 9th of March, we are at Khar at House of Cure, and we'll be regularly based at Thane. So Wednesdays we do our sessions in Thane. You can join us for our sessions in Thane for any sort of appointments. Imran Sheikh has a question. I have disc bulge in L4, L5. Will chiropractic treatment work, and how many sessions will it require? I'll have to understand your movement. I'll have to understand the report that you have and your present complaints. Based on that, once I see you for the first time, I'll be able to tell you how many sessions would you really require. Sohail Azhar has a question. Is neck slip disc curable? Sohail, I don't know what is your age, but if you talk to me about this neck slip disc is what you have mentioned. So basically, for an individual like me, let's say I'm 42 years old and I don't have any neck complaint right now. Okay, now though I do not have any neck complaint, but if you do an MRI for me, you will see that I will have certain areas of disc issues. Okay, and these are absolutely normal degenerative issues that are happening with your body. It doesn't mean that you have some major diagnosis. Yes, a lot of times your disc bulge can be bad, where it starts compressing the nerve and gives you excruciating pain. So that's where you need to get into some sort of intervention. But normally this would just be an overall photograph. What is more important is understanding what is your lifestyle, how in your lifestyle you're not able to balance or manage these things, because of which probably you are undergoing this kind of neck or back pain. And so don't take your MRI to your heart and feel that, oh my god, this is my diagnosis and I'm really bad. I really see a lot of patients coming up with their diagnosis more in their mind than in their body. I can show you so many people for whom surgery has been advised by orthopedicians or by surgeons, and when they actually say that, okay, fine, I'll get it treated without surgery, I don't want to go for surgery, I just want to get it cured in some holistic way, probably by medicine, probably by exercise, or probably by taking care of my lifestyle. Most important, by taking care of my lifestyle. So you need to understand what in your lifestyle is going wrong and correct that. So I think that's very important. And so yes, disc bulge in that case is curable, and I have seen a lot of patients, and it's all about maintenance. Now you may ask me that if someone cures your disc bulge at this point of time, will it come back? Yes, it will come back if you don't take care of your lifestyle. Yes, it will come back if you are not exercising or probably taking care of your posture. So we are trying to be just mean by expecting things to just get better. It's not going to be like that. Our body after a certain age is only degenerating, and it is our responsibility to take care of our health by eating right, by exercising well and sleeping well. Okay, so these are important things that we should take it as an individual and as a responsibility. So yes, neck disc is curable. Shweta Kiwani, you can connect me for the consulting charges. You can DM and we can tell you the consulting charges for the same. So thank you so much once again, guys, for joining in. It was a lovely live session and looking forward to see you. Do share this video with people who you think may need it and who can be for whom it can be helpful. So make sure you share that. I have one more question. Sciatica treated effectively with a chiropractor. Yes, a lot of times sciatica has been treated effectively with a chiropractor. This question is coming from Sachin. Yes, it can be treated, and it also requires some follow-up exercises that needs to be done. And once you have that in place, it can be treated effectively. Like I said, again, sciatica is just a condition. It's not like a diagnosis that you have to live throughout your life. The moment your muscle tightness is reduced, the moment your movements get better, the sciatica will also get better. So you need to focus on the later part of it. For immediate pain, probably some sort of adjustments or probably a painkiller or anything of that sort may help. But if your health or lifestyle is not changed or not managed in the right way, the sciatica will come back. And if you don't want make it to come back, probably you should look at getting the exercises right and eating right. So thank you so much, guys, for joining in. Yes, you can. Puneet Sharma has a question for L4 L5 disc herniation. Shall we go for a chiropractor? Depending upon the severity, what is your severity at this point of time, what are your complaints, and how bad are you clinically? Based on that, you can take a call whether you should go for a chiropractor. But there is no harm in checking out for a chiropractor and trying their therapy for a while, right? Thank you, friends. Thank you so much for joining in, and looking forward for the next live session. You could also post in what other topics you want me to talk about when it comes to chiropractic therapy, and I would be more than happy to do that. And yes, you can put in your questions even in this video, and we can take this in the next live session. Thank you.